Hello everybody, my name is Leah Hosseini. Today's date is January 6th of 2026 and I'll be using this page for reference. Hello everyone, my name is Leah Hosseini and today's topic I chose Alzheimer's disease. And the reason why I chose that, and this topic is really personal to me because of my grandmother who had Alzheimer's and who had passed away on February 3rd of 2023. So I've seen how this condition affects not only me and my family, but also the person who has it. So seeing this up close to me made me want to understand what Alzheimer's actually is and why it happens and why the condition is so serious. I'd like to pass that on to you guys. What Alzheimer's disease is. Alzheimer's disease is a condition that slowly affects the brain over time. It mainly impacts memory, thinking, and behavior, and it doesn't all just happen at once. At the beginning, the changes can be very small and very easy to miss. Someone might miss a recent appointment, repeat questions, forget recent conversations, and these are misplaced things over time more than usual. But as time goes on, these memory problems become more noticeable and start to interfere with everyday life. Eventually, Alzheimer's disease makes it hard for a person to take care of themselves or even live independently. And this is why Alzheimer's disease is considered the most common cause of dementia in older adults. One thing to understand about Alzheimer's disease is that it's progressive, meaning it gets worse over time. There's 3 different stages. There's early stage, middle stage, and late stage. Those 3 stages. In the early stage, a person may still function fairly and even hide their symptoms, but in the middle stage, memory loss becomes more obvious, and the person may struggle with daily tasks like managing finances, cooking, or even remembering conversations or remembering appointments. But in the late stages of Alzheimer's disease, it almost affects every part of a person's life, and at this point, they need full-time care and support. And this gradual progression can be very difficult for the person itself and their family because the changes happen extremely slowly but are very permanent. And I would say that Alzheimer's disease is classified as a chronic condition, which means it doesn't go away and it requires long-term care. It's also classified as a neurodegenerative condition disease because it causes the brain cells to slowly stop working and eventually die out. And these areas of the brain that are affected are the first ones that are responsible for memory and for learning, which explains why the memory loss is usually the first symptom people usually notice. And as more areas of the brain are involved, the problems become with language, with judgment, and behavioral begin to appear. And why this happens, there's no exact cause of Alzheimer's disease, because it's not really understood, but that's why researchers have researched and know a lot about what goes on the inside of the brain. For starters, there are certain proteins that build up in the brain where they shouldn't be, and this causes damage to the brain cells. And over time, these damaged cells can stop communicating with each other, which affects memory and it also affects thinking. And eventually, the cells die out, and the brain actually starts to shrink. And there are certain risk factors that increase the chances of Alzheimer's disease. This includes older age, this includes family history, this includes genetics, this includes medical conditions like hypertension, diabetes, and heart disease. And having these risks doesn't mean someone will definitely develop Alzheimer's disease, but it does increase the risk. Alzheimer's disease falls under the central sensitive syndrome, which means there is a dysfunction in the central nervous system. The central nervous system controls memory, thinking, behavior, and decision making. When the system is damaged, it affects how a person understands the world around them and how to interact with others. And this explains why Alzheimer's disease affects so many aspects of a person's life and not just memory. And what the patient really experiences is people with Alzheimer's disease experience a wide range of symptoms that change over time. Early on, memory loss is the most common symptom, especially forgetting recent conversations or events. But as this disease progresses over time, individuals themselves may become more confused about the time that it is or the place that they're at and have trouble following conversations. They may also struggle with language, such as finding the right words to say or even understanding what others are saying. And emotional changes are also common, including anxiety, depression, frustration, or even irritability. And these symptoms can be very frustrating or upsetting for the person experiencing them, and especially when they're aware that something is wrong, because that does happen. They do understand what's going on, but at the same time not. What healthcare providers start to notice is that from a healthcare provider's perspective, there are several signs that suggest Alzheimer's disease. Providers may notice poor judgment, difficulty concentrating, and problems with problem solving, and patients may appear disorientated and unsure where they are and what day it is. And as this disease advantages, personality changes, and that becomes extremely more noticeable. In later stages, patients may no longer recognize close family members and may require help with basic tasks like eating, dressing, bathing. And at this point, full-time care is completely necessary. And how Alzheimer's disease is diagnosed is that diagnosing Alzheimer's disease is not based on one single test, like what usually people think. Doctors usually start by asking questions about memory, daily functioning, and changes in behavior. There's cognitive tests that are then used to evaluate memory, attention, and thinking skills. And when these tests show a steady decline over time, Alzheimer's becomes more likely. Brain imaging, such as MRI scans, that can also be helpful. And these scans often show the shrinkage in certain areas of the brain, especially those related to memory. And all of this information together help a doctor make an accurate diagnosis. One condition that can look similar to Alzheimer's disease is vascular dementia. Vascular dementia is caused by reduced blood flow to the brain and often due to strokes. The key difference in how symptoms progress in vascular dementia are often worsen suddenly or in steps rather than gradually. A person's medical history and brain imaging help healthcare providers tell those two conditions apart. There are several complications that come with Alzheimer's disease can lead to, as memory and judgment decline, people are more likely to fall or injure themselves. There's high risk factors. Difficulty swallowing can increase the risks of choking or pneumonia. Poor nutrition and dehydration are also common as the disease progresses, and eventually many individuals with Alzheimer's require long-term care in the facility. The disease can ultimately become life-threatening, and it is also important to recognize the emotional and physical strain placed on the caregivers and on the family. I have a personal connection to this because watching my grandmother go through this with Alzheimer's disease made me realize how challenging this condition really is, not just for her, it's for everybody around them. And it wasn't just about memory loss; it affected her personality, her independence, and her relationships. From going to somebody that is so articulate and so clean and so OCD to somebody that didn't even understand how to go to the bathroom on their own. And it showed me the importance of patience and understanding and support are so important for both patients and families. This experience is one of the reasons why I'm interested in healthcare and learning more about conditions like Alzheimer's disease. And in conclusion, Alzheimer's disease is a progressive condition that affects the brain, memory, and daily function, and it falls under the central nervous system syndrome and leads to serious physical, emotional, and social challenges. Because of my personal experience, I believe it's especially important to understand this disease and provide compassionate care to the ones that need it and the ones that are affected. Because learning about Alzheimer's disease helps healthcare providers, patients, and families better prepare for the challenges that come with it. Thank you so much for listening, and have a good day.